everyone, and welcome to Dr. Emmett Emery Sr. podcast. This is continuation this week, this podcast from last podcast. Last podcast we talked about PTSD. We're still going to be on the PTSD topic, but I talked about what PTSD was exactly and that it was worldwide. It was globally, not just in one particular area. So today I'm going to talk about the symptoms of PTSD. Symptoms for women, symptoms for men, symptoms for young adults, and symptoms for kids and teenagers. So you know there's different symptoms in each individual with PTSD. PTSD is a serious thing, and that's why I did 2 series on PTSD. Common symptoms, well, women are nearly twice as likely as men to develop PTSD. I said it before the last podcast. I'm going to say it again leading off this podcast so you understand that. The misconception that men get PTSD more than women. Men get diagnosed more than women. And they may experience symptoms such as intrusive thoughts, avoidance behaviors, and heightened emotional response. That's the basic symptoms that you can probably hear them talk about. But let's get into some symptoms today that you probably don't even recognize in individuals, male, female, teenage, and kids. First, the common symptoms of PTSD in women. Intrusive thoughts, as I said. Women with PTSD often experience intrusive memories, nightmares, or flashbacks related to the trauma event. These episodes can be vivid and disruptive, leading to chronic fatigue and distress. And also distant. These are symptoms that allow them to be distant and non-talkative. Avoidance behavior. Many women may avoid places, people, or activities that remind them of the trauma. This protective mechanism can significantly alter their lifestyle and lead to isolation. Hyperarousal. Symptoms of hyperarousal include heightening anxiety, irritability, difficulty sleeping, and being easily startled. Women may experience these symptoms more intensely than men. Emotional numbness. Women may feel detached from their emotions or experience a lack of interest in activities they once enjoyed. This emotional numbness can contribute to feelings of isolation and depression. Cognitive and mood symptoms. These can include difficulties concentrating, negative thoughts about oneself or the world, feelings of guilt or shame, and a sense of hopelessness. Women may also experience more severe mood swings and anxiety compared to men. Now, the unique aspects of PTSD in women. Higher sensitivity. Research indicates that women may be more sensitive to trauma reminders and experience symptoms for longer periods compared to men. Co-occurring conditions. Women with PTSD are more likely to experience other mental health issues such as depression and anxiety alongside PTSD. So women get a combination of things along with the PTSD. I think sometimes that might be the reason why the PTSD gets misdiagnosed. Impact of societal factors. Societal genders, roles, and lack of support can exacerbate PTSD symptoms in women, making it critical for them to seek social support and professional help. They tend to not engage themselves. Understanding the symptoms of PTSD in women is essential for early diagnosis and effective treatment. If you or someone you know is experiencing these symptoms, it is important, very important, to seek help from a mental health professional. Early intervention can significantly improve outcomes and quality of life for those affected by PTSD. That's the symptoms for women. Now, symptoms of PTSD in men. First, flashbacks. Reliving the trauma event over and over as if it is happening again. This can happen in your mind, and you can receive this also through thoughts, through dreams, so to speak. You may also feel like you are re-experiencing the trauma in your body. Sometimes flashbacks are also called intrusive memories. I remember the flashbacks that I had from events. It actually felt like I was actually involved with it. it actually felt like I was yelling out or trying to talk. And then I'm trying to move in the bed to turn over, and I couldn't move my body. And then when it stopped, I woke up. I realized that, man, that's tough. I didn't have control of my mind, but yet I was asleep. Nightmares, bad dreams or nightmares about the traumatic event. These may be so real that you make up feeling frightened or sweating. Now it's real bad. PTSD is real bad when you're having daymares. I don't call them nightmares. You're having these nightmares at night. You have them in the daytime. You take a nap in the daytime. You fall asleep in the daytime, and then you have these flashbacks or these nightmares in the daytime, which is scary. And then they resume again at night. It's like a repeat of it. You're like, what the heck is going on here? Relate to people, places, thoughts, or situations. You may even avoid talking about the event. Changes in thinking and mood. It is common to have trouble after a trauma, remembering things or concentrating. You may also feel numb, detached from others, or have negative thoughts such as, I'm bad, the world is dangerous, or I'll never be good again. In addition, you may lose interest in activities you once enjoyed. You might feel irritable, more aggressive than before, or have sudden mood swings. Changes in physical and emotional reactions. You may be more irritable, anxious, or easily startled than before. You may also have trouble sleeping or lose interest in sex. Your startle response may be stronger than it was before. That means that you startle and you swing. I mean, you react to the startleness. You just don't be startled and just say, oh, and then catch yourself. No, you startle and then you protect yourself. You swing. In addition, you may feel like your life is in danger, even when it is not. On the other hand, you may feel hopeless about the future. Constant reminders of the event. You may be constantly on guard for signs of danger. This can lead to exhaustion and cause you to miss work or avoid social activities. You might also have trouble driving or being in crowded places, feeling keyed up. You may be jittery, easily agitated, or always on the lookout for signs of danger. This is called hyperarousal. I talked about it in the female symptoms. It can make you feel like you are in danger all the time, even when you are not. Sometimes there may be physical symptoms such as racing heart, sweating, or trouble sleeping. This is some of the symptoms that I had as a teenager in the neighborhood. That you're feeling keyed up. I mean, you're having this anxiety. You're constantly looking over your shoulder. You're walking around trying to make sure that you see everyone that come up, or you're looking at people on the other side of the street. You're walking on one side of the street, and you're just feeling that anxiety and that anxiousness. The impacts of PTSD symptoms in men. Relationships. PTSD symptoms can lead you to withdraw from friends and family. PTSD can make you become irritable and often lash out. As a result, you can lose close relationships and feel isolated and alone. At work, impacts PTSD have at work. Symptoms, impact of PTSD symptoms in men that you can have at work. PTSD can also make it hard to concentrate at work or keep a job. For some men, the thought of going to work triggers their PTSD symptoms. This can lead to absenteeism, loss of productivity, and even being fired, absent a lot. Substance abuse. Many men self-medicate with alcohol or drugs to try to cope with their PTSD symptoms. Temporary fix. This can lead to addiction and make PTSD symptoms worse. It is important to get help from a mental health professional if you are struggling with substance abuse. Can't cure it on your own. You're going to need help. Physical health. PTSD can also lead to physical health problems. Men with PTSD are more likely to have heart disease, diabetes, and high blood pressure. They're also at risk for gastrointestinal problems, sexual dysfunctions, and chronic pain. How to treat PTSD symptoms in men. It's important, gentlemen. Cognitive behavior theory. One of the main types of therapy for PTSD is called cognitive behavior theory, CBT. CBT helps you understand how your thoughts and feelings are connected. It can help you change the negative thought patterns that are part of PTSD. Exposure therapy. This type of therapy can be helpful if you are having a lot of nightmares or flashbacks. In exposed therapy, you work with a therapist to slowly and safely confront the things that trigger your symptoms. This can help decrease your fear and anxiety around these triggers. Medication. Several types of medication can be used to treat PTSD. These include antidepressants, anti-anxiety medications, and antipsychotics medication. Medication can be very helpful in managing symptoms, but it is important to work with a doctor to find the right medication and dose for you. Support groups. An important part of recovery is finding support. There are many groups of people with PTSD. These groups provide a safe place to share your experiences and connect with others who understand what you are going through. Be very careful with the support groups, because even though in the groups they say they can support the PTSD, every individual who has PTSD is suffering PTSD for them. What I mean by that, each individual might have a different type of PTSD. You could have two individuals that fought the same war, stood right next to each other in battle. They both have PTSD, but one could have PTSD from the sound of the ammunition. The other could have PTSD from the sound, from the sight of the enemy coming towards them. So be careful with these support groups, because that support group may not be beneficial for the type of PTSD that you are suffering from. How to manage PTSD symptoms in men. This is when you're dealing with someone who has PTSD. How to manage it. Talk to someone who understands, a therapist. Be careful who you're communicating with. Not everyone understands PTSD. And I'm still wrestling with the fact that an outsider outside of military can help someone with PTSD in the military if they have not experienced what's going on in the military. When I say military, I also mean government workers. Someone who haven't played the sport that you have PTSD in, from concussions or inability to make a professional team or things of that nature, or bullying or whatever. If they haven't experienced that, it's difficult to connect to the individual. But you have therapists and doctors who have experienced those things. And those are the ones that connect directly on a personal level to you. Just be careful. You might have to ask the right questions. Avoid alcohol and drugs. Get help from a treatment center, like I said earlier. Exercise. Exercise releases endorphins, which have mood-boosting effects. A healthy diet and regular exercise can also help improve your sleep, which can be disrupted by PTSD. Gentlemen, get off your derriere. Get to the gym. Walk on the treadmill. If you're in different type of season for different geographical area that you're located, walk outside. In the fall, you put a jacket on. In the summer, have shorts on. Make sure you keep your shoes on, though. Get out there and exercise. Walk. Be productive. Get your body active. It's tough trying to get that diet, man. I know that. But at least eat something healthy. If you're going to eat a pack of cookies, eat 2 apples behind it. Sorry, wives. Connect with others. Join a support group or talk to friends and family members about what you're going through. At some point in time, you got to talk to family. I'm not talking about distant family. I'm talking about immediate family. That means your spouse and your kids, and sometimes even your parents, depending on your age or if you're living with them. Even if you talk to your spouse and kids, sometimes you got to still let your parents know what's going on. Be careful with the friends. If you're a war veteran and your friend never been in the military, they don't understand what you're talking about. If you're a rape victim and your friend has never been raped before, they don't know what you're talking about. See, because they might be in an impression that only one sex get raped. We know both males and females go through that situation. So be careful how you communicate with your friend. You know your childhood friend. You know what you can say and can't say to your childhood friend. You know some of the friends that you associate with. You know what you can say and not say. Because you say the wrong thing to a friend you know you can't say it to, everybody on social media is going to know about it. So be careful with your friend, and be careful with who might be around when you're talking to your friend. So that means you need to pick an area where it's just you and your friend, because that third party listening, they don't know you from Adam. Even if they do, they probably don't care because you haven't associated with them. Therefore, they're not a friend, and they end up putting it on social media. So be careful. Common symptoms of PTSD in teens. Parents, I know you're waiting on this. And the misdiagnosis that's going on with teenagers over the years has been pretty sad. First thing, re-experiencing the trauma. Teens may relive the traumatic event through flashbacks or nightmares. This can include vivid memories that feels as if they are happening again, often triggered by reminders of the trauma. With teens, it's hard for you to understand what the trauma is because they won't tell you. Out of fear they fear your safety, of knowing that someone probably threatened and told them they're going to cause harm to you, the parent, or out of fear for them not wanting anyone to know because they might feel embarrassed about the fact that happened. They might blame themselves for the event. They might feel that they may fear that person that did the event and be afraid to talk about it. And therefore they keep it in, and other things escalate from that in closeness. Avoidance. They may avoid places, people, or activities that remind them of the trauma event. This can lead to social withdrawal and reluctance to engage in previously enjoyed activities. You tell that child, you love cheerleading, but something might have happened that pushed them away from cheerleading, or something might have happened at trauma relating to cheerleading. Cheerleading is one of the sports that has a lot of bullying in it. Has a lot of put down in it. Has a lot of disrespectfulness in it. And women can put up with it and can't put up with it. I think the teens put up with it, female put up with it until it goes on social media. And then when it goes on social media, then everyone gets to know it. Teens get bullied through sports. Males get bullied through sports as well. If you're not that good, but you're good enough to make a team, you get bullied. You never get any playing time. You get used to being on that part of the bench. I don't even know why you get dressed out. You pick the towels up for us. That individual end up going to these stages of PTSD, and they don't talk about it at home, because if you make a sports team, high school, middle school, high school, college, I mean, that's a big thing. But the parents don't understand. Some friends don't understand. Even though you make that team, you still want to play. And even though you not getting the playing time that you should deserve, some of the star athletes are so self-centered, and some of the people who do get the playing time are so self-centered that they bully you. They cause the bullying to happen. And sometimes those individuals lose motivation, or the individuals get better. For example, professional basketball. The Chicago Bulls, and they was going through the winning the championship stages. Scottie Pippen he was a small forward. He came from a small school in Arkansas. And before he even started playing basketball, he was a towel boy. His freshman year, he was a towel boy. And then over that summer, I think he went from 5'10", 5'9", 5'10" to 6'6". So all those bullies that messed with him when he was a towel boy, I bet they was his boy. When he came back from that summer, he was 6'6". He had some long arms too, and he ended up being a Hall of Famer. Had 6 championship rings. I mean, they won a championship for a century. Probably would have won 2 more if Michael Jordan hadn't retired. Increased arousal. Symptoms such as hypervigilance, irritability, difficulty sleeping, and trouble concentrating are common among teens. Teens may feel constantly on edge or easily startled, and some of the parents don't recognize it. They say, "What's wrong with you, boy? What's wrong with you, girl? Why are you so jumpy? You're such a scary cat." Every time I say something to you, you're jumpy. Every time I come at you, you're jumpy. Well, you might come in to approach them on their blind side. And that blind side, when they don't see you, they're jumpy because they have PTSD. Emotional numbness. Many teens with PTSD experience feelings of detachment or emotional numbness. They may struggle to express emotions or feel disconnected from the surroundings and loved ones. Then you misdiagnose them. You misdiagnose them, said that they have an isolation problem. They have a different type of disability, or you don't know what's wrong with them. They like to keep to themselves. They're quiet. They never talk to me. They might feel you're not approachable, and that's why they don't talk to you. Or they might feel, like I said before, that they fail you, and they don't want to talk to you. They won't let you know what's going on. And with some teens, it doesn't stop. It might still be going on, and they feel embarrassed to tell you. I remember a friend of mine's sister, when we was in college, his younger sister was taking piano lessons. And the gentleman that was giving her the lessons was taking advantage of her sexually. But she never told anyone. And she took lessons with that gentleman from age 10 to age 15. And they found out that it started 2 months after she started taking lessons. But she didn't want to disappoint her parents because they felt that she was finally involved in something that kept her attention and kept her going. She later said the playing the piano soothed her. It put her in a calmness. She said it was just her and the piano and the music. And she said when she was done playing the piano, even in practice, she came back to reality and she felt rejected. And she felt depressed. She had an anxiety. This teenager had PTSD. And no one knew it. Why? Because we are under the impression that PTSD is for men and women. We forget about the teenagers that go through trauma. Forget about the teenager that go through anxiety, depression. I went through more stress as a teenager and at high school and in middle school, like 8th grade middle school, than I did in college and the rest of my life. I don't know why. It's like everyone was so nasty back then. And later in life, I saw some of the kids that was nasty and they were so mild and approachable later in life. But some of the ones that were nasty, I still wanted to kick their ass. I'm sorry, I wasn't supposed to talk like that. I still just wanted to just take them. And I felt like I was cheated. I felt like because I was small and I didn't get a chance to defend myself back then, that I had the opportunity to do it later in life. And then it didn't feel the same because the person was so nice and approachable. And I said, I waited all my life just to jack you up, and I can't want to do it because I'm feeling compassion for you. Risky or self-destructive behaviors. Unlike younger children, teens may exhibit impulsive or aggressive behaviors as a way to cope with their feelings. Some may lash out to their parents. Some may lash out to their friends. Some may lash out to their teachers. Some may lash out to doctors. They become very aggressive. They don't want to be approached. Their comfort zone or their space is extended another 2-3 feet, it seems like. Well, you can get into, you can violate their space in the beginning as a teen, and then when they go through this the depression, anxiety, PTSD, then they put their space out a little bit further. And they feel very timid and anxious if you violate their comfort zone. This can include substance abuse. A lot of teens get involved with drugs, reckless driving, or other high-risk activities. And usually with that reckless driving come with the drinking of alcohol. They said drugs, but a lot of teens consume alcohol too. Physical symptoms. Some teens may experience physical symptoms such as headaches. I always got a headache. Oh, my head is hurting, my head is hurting, my head is hurting. And into sports, you think it's just a concussion. So you get them treated for a concussion. They say, no, it's not a concussion. Stages of PTSD. Stomach aches. This is a hard one for a female teen because my stomach ache, my stomach ache, my stomach ache. First thing a person thinks when a female says that stomach ache or they have stomach pains is that they're pregnant or it involves their menstrual cycle. But that pain also can be from PTSD or other unexplained pains, which can be linked to the emotional distress. Importance of recognition and treatment for teens. Recognizing these symptoms early is critical and crucial, as untreated PTSD can lead to long-term issues such as chronic anxiety, depression, and difficulties in daily functioning. If you suspect a teen is experiencing PTSD, it is important to seek help from a medical health profession who can provide appropriate support and treatment options. By understanding the symptoms of PTSD in teens, caregivers and educators can better support affected individuals and encourage them to seek the help they need. And that's one of the reasons why I retired from supply chain management after 35 years and decided to come over to behavioral therapy, to be a behavioral therapist because of the PTSD. But it was the PTSD in military veterans and active duty military that drew me over to it. But once involved in behavioral therapy, behavioral health, I realized that it goes beyond that. You got females, not military, non-military, non-veteran. You got teens, and you got children that needs the help for, I call a sickness that no one is even diagnosing them with. So I'm one of the few who's now coming over into a profession that is hurting for behavioral therapists. And glad to be here. Common symptoms of PTSD in children. Re-experiencing the trauma. Children may have intrusive thoughts or memories about the traumatic event, nightmares or flashbacks, and make them feel as if they are reliving the experience. I can't sleep with the light off. I see things. And the first thing the parents said, or you see animals, or you see a bear, or you see a dog, or you see ghosts, or you see... No. If they experience something with an individual, they see that individual face in the dark. I mean, we need to listen to our kids and not just assume that we know what they're talking about. And they do this probably only when the light goes off. So they can't sleep in the dark. Give them a nightlight. Help them out. Help them get through this. It might not be sprung out PTSD. It might just be something mild. And just giving a nightlight might help that as far as sleeping in the dark. Some kids might be afraid to get up and go use the bathroom at night. So they wet their bed. And what do some parents do? You're too big to keep wetting your bed. What's wrong with you? You need to get your butt up at night and go to the bathroom. No more drinks before you go to bed. Might not even be that. Liquid before bed. It's just that they're afraid to get up at night. So they lay there and wet their bed. And they feel bad. They feel upset. They feel nervous. They feel scared in the morning when they get up. Because they know you're going to find out. Some kids try to get up before you get up, take the pajamas off, take everything off, and throw it in the laundry and try to change their bed. Some kids even start the laundry at 4, 5, 6, 7, 8 years old. That means they never complete the process. They attempt to. And then the parent to be upset. Listen to your kids. Try to find out what's going on with your child. Avoidance. They might avoid places, people, or activities that remind them of the trauma. I don't want to go to school. I don't want to go to that classroom. I don't like that teacher. I don't want to play soccer anymore. I don't like that coach. Something might have happened. It didn't have to be anything physical. happen. It could be the way they talk to the child that scares them, that make them feel uneasy, that frightens them, that individual, the adult, need to correct. And they're probably not even aware of it. They probably treat their kids that way and it's okay. And they think they can treat someone else's kid that way. They shout at their kids and tell them to sit the hell down and blah, blah, blah. But other kids probably wasn't raised that way. And you say the same thing to them and then you scare them. But they're afraid to go to the parents and tell their parents. Talk to your child. You talk to them long enough, they will tell you. Emotional numbness. Some children may appear detached or emotionally numb, showing little reaction to events that would typically elicit a response. They may also seem sad, irritable, or anxious, especially when certain people come around. They come grab your leg or they sit right next to you or they leave the room and won't come back out. Look for those signs. Increased arousal. Symptoms can include difficulty sleeping, irritability, and being easily startled. Children may also have trouble concentrating or exhibit aggressive behavior, just like teens. The kids go through that too. Physical symptoms. Children may experience physical complaints such as stomach aches or headaches without clear medical causes, often linked to their emotional distress, just like teens. Age-specific symptoms. Preschool age kids, 1 through 5 years. They may show signs of aggression, such as bedwetting or thumb sucking, and may have temper tantrums or increased clinginess. Cling to the mom, cling to the dad, cling to the siblings. Those are signs for preschool age kids, 1 through 5 years. School age kids, 5 through 12 years old. Symptoms may manifest as a play reenactments of the tantrums, nightmares, or avoidance of reminders of the event. They may also express fear or sadness more openly. Don't call them scary cats. Don't call them wimps if they're boys. Adolescents, age 12 to 18 years old. Teens may turn to substance use as a coping mechanism and may exhibit more pronounced emotional and behavioral issues. Importance of early intervention. Recognizing these symptoms early and seeking help from a mental health professional can significantly improve a child's recovery and overall well-being. Treatment often includes therapy, which may involve talking, play, or art therapy. We're talking kids. And sometimes medication to help manage symptoms. If you suspect that a child is experiencing PTSD, it is crucial to consult with a healthcare provider for proper evaluation and support. Early intervention can help mitigate the long-term effects of trauma and promote healing. PTSD is not a centralized sickness, as I call it. It's global. It's all over. And it's certain things that trigger effects PTSD in every species of life, animals too. If a human being, if a man, a woman, or a child can have seizures, cats and dogs have them too. Man, woman, and child have allergies. Cats, dogs, horses, pigs, chickens, they have them too. If humans, men, women, children have PTSD, you believe animal has them too. So try to remember the symptoms that I gave you. And try to remember from the first podcast, we talked about what PTSD actually was. And remember, it's a global sickness. I thank you. I appreciate you. Subscribe to me. Good night, good day, good morning, wherever you're located. And goodbye.